All right, welcome everyone. Good afternoon. So glad that you're here, and I love seeing some familiar voices. I'm going to lose my voice. That's what I was. Some familiar faces. Sorry. So you're joining using superpowers to advance health equity, and this is exciting because these are two of my favorite presenters. We have Melissa Adolfson and Jackie, I'm not sure I will say your name right. Freund. Okay, I still didn't say it right, but I'm so glad that you're both here. I think during this session, they're okay with taking questions as they go. Otherwise, you can wait until the end, whatever you prefer. So just a real quick, Jackie helps communities analyze and make sense of their data to further their prevention goals, which is really cool. And we all need help doing that, or at least I do. And Melissa has over a decade of research and evaluation experience. And I'm so excited to welcome you both. And I turn it over to you.
Jackie, do you want to pull up the...
I'm going to share my screen.
So I know we lost a little bit of time with the link issue, but I naturally talk fast and I can amp that up. But if I'm talking too fast, I think that Zoom has like a little icon with a turtle, just like flash that and I'll slow down. So Jackie and I are going to be talking about using protective factors to be a superhero in the lives of young people. And for those of you who were not in the morning session that featured Nancy Riestenberg from the Minnesota Department of Education, she shared some super cool focus group data from some Ramsey County students who were asked how adults could support them in their lives. And what the student said is, smile at us, call us by our name, and show interest in our lives. So if during Jackie's and my session, you get distracted by a spouse, a kid, a pet, your inbox, what have you, like Nancy's words of wisdom about how you can be a superhero, smile at us, call us by our name, show interest in our lives, that's all you need to know, really. We're going to be doing kind of a much deeper dive in the weeds of the data, of taking a look at some nuance when you disaggregate data by race ethnicity. Also, I just wanted to let people know that Jackie and I did an almost identical session during program sharing 2 years ago. So if anyone on this call saw that, there's not a ton that's new here. So not kicking you out of our session, but I would strongly encourage you to attend one of the other amazing sessions that's happening right now. Because we can move on to the next slide. I also wanted to kind of give a shout out and thank you to any of you on the call who encouraged your schools or played a role in your schools taking the 2022 Minnesota Student Survey. Thank you, thank you. I wish we had the 2022 data to share with you now, but I think the 2019 data is still super relevant. But before we get started with the data, we want to spend some time talking about superheroes. So I borrowed these slides from a coworker of mine at Wilder Research. And you may already have your own superhero name, and that's fabulous. You go with that. We're not trying to be too prescriptive, but for those of you who, like me, are not super creative, you can use this handy dandy chart. So on the left, if you pick the first letter of your first name, you can identify the first name of your superhero doppelganger. So in this case, my name starts with an M, so I'm Turbo. A chart on the right, you use the first letter of your last name. My last name is Adolfson, so I would be Gem, and that makes my superhero name Turbo Gem. That doesn't really speak to me, but hopefully this list gives you some other ideas that you can pick from. If you have any interest in doing so, feel free to enter your superhero name in the chat box. It's always fun to see like what kind of combinations we get. Like Crimson Claw, that just seems a little bit more, oh, Ghost Justice, I like that. Ultra Asian Spice, that is fabulous. Mighty Ranger. Wow, this is fun. Thank you for indulging me in this. So Jackie, do you want to move on? Yep, thanks. So the next part after you've picked out your Steel Secret Agent Guard Justice. Once you get your name, then the next step is identifying your superpower. Once again, pick your superpower, what speaks to you. If you're not feeling so creative this afternoon, you can use your birthday month. So my superpower is duplication. And gosh, I wish I had that right now because I could use 3 of me. But any of these would be lovely to have at any point in time. And then last but not least, over and above your superhero name and superpower, there are some optional superhero stances that you can pick from. I am super clumsy, so I would definitely gravitate towards the stances on the right where like both feet are solidly on the ground. But I tried so hard to learn how to make a Bitmoji and was unsuccessful, but Jackie did make a superhero Bitmoji of herself, and you'll be seeing that later in the presentation. So once again, we're going to be talking about the power of protective factors and how protective factors can really buffer the impact of risk factors like ACEs. And ACEs writ large, so adverse childhood experiences, bullying, dating, violence, violence in the community. And then also it's important to note that protective factors can have a cumulative impact. So it's not just protective factor 1 plus protective factor 2 equals the sum of those, but they can really have a cumulative and additive impact. And what we're really finding and hearing in this gathering today is that communities are really rallying around using a more strength-based approach. And protective factors like the ones that we can identify from the Minnesota Student Survey are really actionable and action-oriented. And so that's what we're going to be focusing on today. Thanks for that, bam, Jackie, is how to take our Minnesota Student Survey data and move it to action. The other thing that we want to focus on today is the power of disaggregating your data to reveal differences and disparities that we wouldn't see if we aren't able to disaggregate it. So with that focus on the positive, we're really wanting to take a look at the strengths that we can see for specific populations once we break the data apart. And it can really help organizations and communities justify the need for resources and support for serving specific populations in their community. So as an example of what we mean by disaggregated data, if we just take a look at the data from this, again, this is the 2019 Minnesota Student Survey on students reporting past 2-week depressive symptoms, we see that overall, about 1 in 5, 22% of Minnesota youth who responded to the survey reported past 2-week depression. But if we break that down and take a look by sex, we see that there is quite a difference or disparity, whereas females are much more likely to report past 2-week depressive symptoms than males. Similarly, if we take a look at students reporting that they feel adults in their community care about them very much or quite a bit, if we just look at that category of Asian, which is a pretty darn big group, we see that about 40% of students who identify as Asian feel adults in their community care. But if we break that down by specific Asian groups, we see that students who identify as Asian Indian are more likely to feel that adults in their community care, especially in comparison to Hmong students. And our goal today is not to compare and contrast students to show which have higher levels of protective factors, but just to show the importance of breaking down that category and recognizing that when all students get lumped together in that category of Asian, we miss some nuance and some differences. And there are a lot of categories that we could use in this session, but we're just going to highlight a few examples just to kind of get at why it's important to disaggregate data. So starting in 2019, a number of different race ethnicity categories were added to the Minnesota Student Survey, which is fabulous. Prior to that, we had the standard categories of whites, Black, Hispanic, Somali, and Hmong were added at some point. But 2019 really gave us a chance to disaggregate data and dig in. So if a student identified as American Indian or Alaska Native, for example, alone or in addition to another racial identity, they were able to identify as either Ojibwe or Lakota. Similarly, students who said that they were Asian or Asian American alone or in addition to another race were presented with a number of options that they could select from, and they could select all that apply. For each of these also, there was an other category, which isn't overly helpful. It just lets us know that there are students who are Asian who identify in other ways. And what the Minnesota Student Survey interagency team is really trying to do is take a look at our census data, our American Community Survey data, and take a look at who's most represented in Minnesota, so that each administration of the survey, they can add more race ethnicity response options. Boom. And so it's super exciting. And I wish, again, if I could duplicate my TurboGem powers, I would have much more time in the day to really dig into lots of other data by each of these race ethnicity categories.
And I just wanted to add in a little point that the 2022 survey did ask about the Middle Eastern, North African categories, which means that the MSS is actually ahead of the US Census on this point, which is very exciting for us.
The other thing exciting that's new for 2022 in thinking about protective factors is students have always been asked about pro-social activities that they're involved in outside of the school day in a typical week. And for the first time ever, cultural heritage programs are added. That's kind of a big, broad category, but it's exciting to finally have that, in addition to things like tennis and karate. And so one thing that we want to stress too is as you're digging into your data and doing some planning around preventing and reducing ACEs, and I know so many people who are part of this gathering are also working to prevent suicide, prevent substance use, build health and well-being. It's just really important as you're planning to take a look at who is in your community and acknowledge and recognize differences in those communities based on their culture, language, educational attainment, the trauma that they've experienced, whether it's historical trauma, pre and during migration trauma, trauma from violence in the community you live in, and also recognizing that each population has unique health needs. So while we're looking at our data, just acknowledging that a one-size-fits-all approach isn't necessarily going to work.
And something that's relevant, I think, to Minnesota is I was doing some research on this and found out that Hmong people have higher cancer mortality rates, for example, which isn't something we would know if we didn't have disaggregated data. So it's important to look at the barriers to care and screening for Hmong people that live in Minnesota. And again, we wouldn't know this if we didn't have the disaggregated data.
The other thing I want to acknowledge too is that the Minnesota Student Survey is super robust and you can really slice and dice the data in a lot of ways. So we're going to be presenting data by categories by race ethnicity, but it's important to note that a student who identifies as Hmong, who is female and lesbian and lives in rural Minnesota, is going to have very different experiences than a student who identifies in Hmong and lives in the metro area and is heterosexual and cisgender. And I know that there are folks who are working on this intersectionality, and I'm excited for the day when it's easier for us to do that. And so, in acknowledging and recognizing and learning about the history of the people who live in your community, in addition to thinking about things like education, health status, it's also important to learn about the stories of how people came here. And starting with the fact that the Indigenous people in the communities in which we live were already here. All of the rest of us, our families, migrated here. And then the reasons why populations moved here are also important to acknowledge, especially thinking about the trauma and the history and the stories that they bring, whether that was people being brought here for slavery, people who moved here to flee violence, whether that's war or civil war, people moving here to flee persecution for their religion or sexual orientation, people fleeing health epidemics, poverty and hunger, or just moving here to provide educational opportunities for their family. And Jackie found the statistics that in any given year in Minnesota, 25 to 50% of the people who move to our state are refugees. And that compares to 8% nationally. So in 2017, we had the highest per capita number of refugees in the nation. So all the more important that it's all the more that it's important that we understand the stories of the people who come to our communities, their strengths and assets, how we can be a superhero to them, but also the trauma that they bring. And I know we don't have a ton of time, so I'm not going to unpack this, but another reason that it's so important to disaggregate the data is that within that category of individuals who would identify as Asian, there are different stories of migration to Minnesota, starting way, way back in the 1800s with Chinese immigrants moving to Minnesota from the West Coast, to more recent migrations of Hmong and Karen people who were fleeing violence and persecution in their communities. And so they bring unique stories and unique experiences. And it's just important to recognize those as we're using existing data from the Minnesota Student Survey, but also when you're going out and doing 100 cups of coffee or one-on-one interviews and collecting stories from people, that just because you hear from a couple of Asian individuals in your community, you're not hearing the full story of the experiences of different types of Asian people who live in your community. Very similarly, the category of Black, African, or African American is just so terribly broad and doesn't tell us a lot when the data are aggregated into a single data point. It doesn't acknowledge the different experiences of people who were brought to the US as indentured servants who became slaves, which is very different than the more recent wave of Somali immigrants coming to Minnesota due to the Civil War. So just kind of acknowledging those different histories and stories. And so we've got some resources for you to dig into either now if you're not liking the sound of my voice or you're a little bored, or after the fact. And I'm going to pop these in the chat too. I know the slides are going to be made available. But the first resource is a great blog by my colleague Nicole Martin-Rogers at Wilder Research about the importance of disaggregated data. There's also a link to some podcasts from from NPR called North Star Journey that's exploring the history and culture of Minnesota communities. I haven't actually listened to the podcasts, but I've heard some of the stories just listening to the radio. And that's kind of fun if you've got some time to dig into it. That third bullet is a brief that we created on the power of protective factors, specifically from the Minnesota Student Survey. And that's something we're excited to update in 2022 once we get the data. And then the last one is an article that actually inspired the power of protective factor briefs that's based on data from Oregon's youth survey. And not only did that inspire me to dig into our MSS data on the power of protective factors and the cumulative impact that they can have, but that article also talked about the differences in risk and protective factors for preventing suicide for students who identify as American Indian and those who identify as not American Indian. And one of the examples of a risk factor for American Indian youth that wasn't one of the top 5 risk factors for non-American Indian youth was not having breakfast 7 days out of the past week. And that showed up for them. So just kind of, of thinking about like the top 5 things that you can do to prevent suicide, being able to dig in and look at that nuance is just so important. So I'm going to hand it over to Jackie now.
Okay, so I'm going to talk a little bit. As you might be able to tell, I have some severe bronchitis going on. So I probably won't be speaking as much as Melissa did, but I'm also probably not as eloquent about things anyway, so maybe that's a good thing. But I'll be mainly talking about the data. We're going to look at a couple disaggregated groups that we've already talked about. So we're going to talk about a couple groups that fall under the category of Asian and a couple groups that fall under the category of African American. And we're going to look at adverse childhood experiences a little bit. And then we're also going to talk about the effect of protective factors on rates of vaping, which is an issue that we're looking at very closely right now because of the introduction of new technologies that children are using to vape, and also depression, which we're seeing rates at an all-time high across the nation, actually. So Adverse childhood experiences have been on the Minnesota Student Survey in some form since the very beginning, but the current administration has 8 different adverse childhood experiences. So these can be totaled into a score with a total of 8. So they're verbal abuse by a household adult, not necessarily a parent or guardian, but somebody in the household. Physical abuse by an adult in the household. Sexual abuse, these are 2 different questions on the survey, but we combine them into one. So by a family member, somebody outside the family. Witnessing domestic abuse between other adults in the household. So this again could be, boyfriends or girlfriends of parents, that sort of thing. Household substance abuse using either drugs or alcohol. And then household mental illness. This was one that was included just in 2019. It wasn't included on the Minnesota Student Survey before that. It is something that's been included in other adverse childhood experiences scores, but was only included on the MSS in 2019. And then incarceration of a caregiver. And so I just want to say that I want to point out that because each survey or study uses its own scale, ACE score comparisons can't be made between surveys. And also there is a link at the end of this presentation in the resources section that gives a little bit of a more explanation about the history of adverse childhood experiences on the survey, on the Minnesota Student Survey, and comparing it to the original survey that was done by the Kaiser Institute. So here we have the main classes or racial groups that we've had traditionally on the census, on the Minnesota Student Survey. So it's a little bit disaggregated, but not super disaggregated. So we can see here already that there are huge differences between groups, right? So Native American and Alaskan Native are half as likely as white students to have 0 ACEs. So the blue bar at the bottom means that the students have 0 ACEs, and then the orange bars at the top are 1, 2, 3, and 4 plus ACEs. So you can see that 75% of American Indian students have experienced 1 or more ACEs. But now within those groups, with further disaggregation, we can see even more differences. First, I want to say, why is this important? Obviously, I think we all here know why adverse childhood experiences are important, but I'm just going to give 2 examples that are just unfortunately illustrated so beautifully, that the use of vaping. So this is a student that has had 0 ACEs. About 9% of them have vaped in the past month, and it goes up to about 56% for students that have had 4 or more ACEs. It's amazing how this can go in exactly a stepwise progression than the number of adverse childhood experiences a student has. So a lot of predictive value, also really depressing in some ways. So here again is some disaggregation. We're just looking at these 2 Asian groups. So on the left side, we have just the Asian American group, and then we have Hmong and Indian. And you can see that there's quite a difference here. About 50% of Hmong students say that they have 0 ACEs, and about 62% of Indian Asian students say that they have 0 ACEs. So there's quite a difference when you're looking at subgroups. And then again, looking at all Black, African-American students, the difference between Black African-American students and Somali students is very stark. And here I want to also point out that we are looking at adverse childhood experiences. This obviously isn't going to capture the whole picture of somebody's embodied trauma. So there's Rachel Yehuda, you've probably heard of her. She's done a lot of research on Holocaust survivors, children of Holocaust survivors, and how those children tend to have really low levels of cortisol in their blood, even though they didn't experience being in the camps. And those people, when they have lower levels of cortisol, when they're exposed to other traumas, were more likely to develop PTSD than other people that had normal levels of cortisol. So it is possible that even though somebody doesn't experience themselves an adverse childhood experience, that they are embodying, the epigenetic results of things that their ancestors have experienced. But luckily we have these shared protective factors. So I just want to remind people that these are available to all students, regardless of their cortisol levels, and that they are shared across communities and shared across negative effects, right? So a lot of these protective factors, they work for depression, they work for vaping, they work for feeling positive, they work for doing well in school, right? So these are shared protective factors. So the ones that we look at specifically in this survey that are on the Minnesota Student Survey are feeling that other people care about them. So that's parents, teachers, relatives, friends, and community adults. We ask about all those. Having supportive adults in your life. So that is, again, teachers, people that are not teachers, and your parents. Feeling safe at school and in your neighborhood. Feeling valued by your teachers and also by your family. And then positive identity, social competence, and empowerment. These are, there are explanations of these at the end of the thing. So these are composite indicators. So positive identity has 6 different questions that go into making up this composite score. Social competence has 8, empowerment has 3. So, and then educational engagement has 6. But so there's an explanation of how all of these scores are developed at the end of the presentation in the resources section. So in here, we're going to look just at our 2 examples here about depression and vaping, about the power of protective factors. So students, this is 8th, 9th, and 11th graders on the 2019 MSS, students who reported that their teachers care a little, some, or not at all. 30% of them report depression, whereas students who feel that their teachers care very much about them, only 12% of them report depression. And the same for vaping. Teachers that care very much, these students, 11% of them vape, but students who feel that their teachers care hardly at all about them, twice as likely to vape. So 22% of them reported vaping in the past month. So I'm going to go through a couple of the communities that we talked about again. So I'm going to talk about the Hmong community in Minnesota, the Indian, Asian, and then African American and Somali students. So the Minnesota Compass has some amazing community profiles. They have profiles for the 26 largest ethnic communities in Minnesota. And I think this is so great. These pages, unfortunately, are just going to have the really basic stuff, like how much they speak English or whatever. They don't necessarily have the most important things, which to me are like, what do people eat at their family gatherings? Like, I found out that, so my family, a lot of my family is from Czechoslovakia. And it turns out that we fold our kolachki in a very specific way that is only done in New Prague, Minnesota, which is where my family is from. So I just think we have a lot of data right here, but sometimes it doesn't tell the best part of the story. Like, what are you eating when your family gets together? So the Hmong community is almost 82,000 people in Minnesota, which I think is about a percentage, 1.5% of the total population of Minnesota. But the Minnesota Student Survey, excuse me, sample size is almost 4,000, which is a very robust sample. Most of those people live in the Twin Cities metro area, and 37% are 17 and younger versus 23 in Minnesota, 23% as an average. So the population skews very young. 35% speak English less than very well. And they have a lower rate of bachelor degree attainment than the average in Minnesota. that 72% are working aged adults. So this is just important stuff to know. This is all available on the Minnesota Compass website. So when we look at the Minnesota Student Survey data and we dive in, we find that among youth relative to other populations are more likely to report that they have an adult other than a parent that they can talk to, which is great, and that they have greater educational engagement. And so we can look at the effect that this might have, right? So students with depression or students with low educational engagement are more likely to report depression, almost 40%. And then students that have high educational engagement are much less likely to report having depression. The same goes with vaping. It's almost 3 times as high when the student has low educational engagement in their rates of vaping. So we have the strongest associations that we found on the Minnesota Student Survey with vaping, educational engagement, social competence, being able to talk to parents about problems and feeling that parents care. And then similar ones for depression. Again, these are shared protective factors. So they're shared across outcomes and across populations, feeling that parents care, feeling valued and appreciated, and empowerment are associated with depression or lowering depression among youth. So what do we do with this? We can look at what needs to be boosted in the communities and develop programs to help boost those. So relative to other populations, they're less likely to report participating in pro-social activities and feeling like community adults care. So they're interesting things to look at. Like again, like the Kolachki thing, it turns out that a lot of Hmong students, their parents grew up playing badminton. And so they're really involved in badminton. So there's a high school right near where I live, Johnson Senior High, and they have, I think it's 100% Hmong population on their badminton team, and they win every year. They're just amazing at it. And they practice a lot in the park across the street from my house, and so much fun to watch them. But so that's something where when you know this little bit of data, or you know this little thing about this community, this might give you sort of an entree on how to get students more involved in pro-social activities and in ways that are going to protect them in other areas of their lives. So how can you be a superhero? And I went over this a little bit, but continue to encourage strong educational engagement. So this might involve looking at the types of things that Hmong students are interested in reading, find out pro-social activities they're interested in, recognize their accomplishments, and encourage adults in the community to show support and appreciation. Again, look at the child, say their name, and ask them how their day is doing. Pretty, should be simple for all of us. So in comparison, although Melissa said, no, we're not comparing, but here we're examining the Indian community. Oh my gosh, my voice. 55,000 Asian Indian people living in Minnesota right now. 89% live in the metro area. 27% are 17 and younger. This is more in line with the Minnesota average. 14% speak English less than well. And 79% of them have a bachelor's degree or higher versus 36% average in the state. So that's interesting to note. And the superpowers for Indian youth, they're compared to the other populations more likely to report feeling that their teachers care about them, having greater educational engagement, which makes sense, involvement in pro-social activities, levels of empowerment, feeling safe in the neighborhoods, and feeling safe at school. And their parents having higher levels of bachelor's degrees might have something to do with those last 2 bullets. So again, here we have students that have low levels of empowerment, rates of depression. for low empowerment and high empowerment, and how it goes down when the students have higher empowerment, and how rates of vaping also go down when students have higher levels of empowerment. And again, empowerment and the way that we calculated that is in the document at the end of the presentation. So the superpowers for the Indian youth. The strongest associations with vaping are social competence, feeling valued and appreciated, empowerment, educational engagement, and that those with depression are different. So positive identity, being able to talk to a parent about problems. That one seems really obvious, right? But it's nice to have the data here to show that. Social competency and feeling valued and appreciated. And what needs to be boosted? They're less likely to be able to talk to an adult other than a parent about problems that they're having. So this is also actionable. And how is it actionable? Partnering with Asian Indian community leaders to explore mentoring opportunities for youth, and identifying culturally responsive counselors and providers to refer youth. Using telehealth, we're all doing that now. Excuse me. And so now we're going to move on to a couple of the disaggregated African American groups. We're going to look at African American community who did not endorse any other category, so not Somali or Nigerian or Liberian. So these are people who have not recently immigrated to the United States. So that's 234,000 and a half people in Minnesota. 81% are in the Twin Cities. 35% are 17 and younger. 19% have a bachelor's degree or higher. And then something that Melissa, I think, noted before, I forgot a little percentage mark there, but 75% live in renter occupied housing versus 29% in Minnesota, which is something to know. I think what's important for there is there's a big push in my neighborhood, for example. My neighborhood has, I talk about my neighborhood a lot, but I really like it. But they, it's one of the highest percentages of renter occupied housing in the neighborhoods in St. Paul. And there tend to be problems with renter occupied housing because landlords often don't take care of things, right? So there's more likely to be lead paint that's not taken care of. There's more likely to be lead in their pipes that haven't been taken care of, and other environmental sort of toxins and other risks in the environment when people are living in homes that are not taken care of by other people, not taken care of by them. So superpowers for the African American youth relative to other populations are more likely to report that their relatives care, that they can talk about their parents, that their parents care about them, and that they have a positive sense of identity. So these are things that we can harness. So students who feel that their relatives care a little about them are much more likely to have depression, and students who feel that their relatives care very little about them are more likely to vape as well. And the superpowers for the African American youth, the strongest associations with vaping are social competency, positive identity, feeling parents care and being able to talk to their parent. And for depression, very similar. So positive identity, feeling valued and appreciated, empowerment, and feeling parents care. And what needs to be boosted, being able to talk to other adults that are not their parents, being engaged in school, feeling like their relatives care, and feeling safe at school, and empowerment. So how can this be put into action? Partnering with community schools to implement restorative practices, leadership opportunities for African American youth, partnering with community leaders for mentoring opportunities, and also developmental relationship training opportunities for teachers and school staff. And here's the Somali community. So again, very different than African American. 78% in the Twin Cities metro area. 51% are under the age of 18. 42% speak English less than very well. And 13% have a bachelor's degree or higher. And again, very high rates of living in renter occupied housing. So I think this is mentioned actually in one of the previous discussions, where there is a group of Somali people who are all living in the same apartment building together, and getting their information and empowering them to work together is actually a benefit. So in that way, I think having a community that's all in one place and can then be mobilized is a positive thing that we don't normally think about when we think about people that are, I think we often think about them as having to be forced to live in rental properties, but maybe in this situation, it's positive for the community. And then superpowers for Somali, they're more likely to report feeling valued and appreciated, feeling adults in the community care about them other than their parents, which is great, and feeling that their friends and parents care, having a positive sense of identity and greater social competency. And again, we see the same relationship that we see every time, right? So if they have high levels of positive identity, they're less likely to have depression and less likely to engage in raping. It's just really amazing to be able to see this relationship in the numbers. I know it's like, oh, we've already seen this 4 times, but I think it's really exciting to show that this is a relationship that stays. It's static, it works across populations and across different effects. So here, the strongest associations are for them really high: social competency, feeling parents care, feeling teachers care, and depression, feeling valued and appreciated, being able to talk to parents, empowerment. And what needs to be boosted? Being able to talk to an adult that is not a parent, and then involvement in pro-social activities. So I think this is another one of those situations where you probably want to get the kids involved to see what sort of activities they would be interested in. So partnering with community leaders to explore mentoring opportunities, again, developmental relationship training for teachers and school staff, and finding out which kind of activities they're interested in and why they're not participating. There's another exciting thing about the Minnesota Student Survey is asking students why they are unable to participate in certain activities. Now, as my voice is going out, we're gonna switch back over to Melissa and she can finish us up.
I'll try and work through this quickly. I know we had some questions in the chat, but I also want to leave a couple minutes at the end. So, okay, Jackie just shared a ton of data. How do we actually use that in our communities? Yeah. Thank you for all the animation, Jackie. So here's like a super simple template that you can use. Like the big thing that we say is do some research first before you go to the community, the populations of your community, and ask them to share their story and the details. Do a little research on your own to learn more about them. Learn more about the historical context and the history and the story of that population moving to Minnesota, but don't necessarily make assumptions that they fit those patterns of migration. Maybe they're relatively new here. Identify local sources, whether that's community partners you can work with, community centers, businesses owned by peoples in that population. Take a look at your Minnesota Student Survey data. Even if you can't drill down at the local level in your data to look at differences by race, ethnicity, you can take a look at which populations in your community and then take a look at the state level data. And then only after the fact, working with that community, identifying what strategies can be used to boost those protective factors. So some resources for doing that, again, find out who's in your community. Sometimes it's super evident. You can just drive around and look at the grocery stores, look at the signs, work with your school to get school enrollment data, but also take a look at the US Census Bureau or the State Demographer's Office to kind of take a look. And it's important to monitor over time because as we get new immigrants and refugees in Minnesota, our communities are changing over time. So then step 2, once you know who's in your community, Go to Minnesota Compass, like Jackie said, there's so much wonderful data that you can learn about that particular community. The Minnesota Prevention Resource Center is always a great resource. They can do like a literature review for you on information about strategies that have worked with that particular population. The International Institute of Minnesota is a great source of data. And then once you've done that research and you found the existing data, making sure that in addition to that existing data and your Minnesota Student Survey data, you're also going out, now that you're more informed, and collecting data through key informant interviews or one-on-one community conversations to kind of dig into the nuance. And especially learning more about the adults in the lives of those kiddos, since we don't have an adult survey that's the equivalent of the Minnesota Student Survey. So not a lot of time, but just like as a quick example, this is what it might look like to complete that template. So let's say in your particular community, you have a relatively large Ojibwe population and a larger Laotian population, as is the case for one of my grantees. So the historical context, learning about the historical trauma faced by the Ojibwe in your community, the boarding school experiences that their families had. For the Laotian community, learning more about the movement to Minnesota as refugees from Thailand. For local resources, it might be that you have specific classes in your school, and you can maybe partner with a school and the teachers to reach those students. In this example for the Laotian Center, there's actually a Lao temple that's a community hub, which would be great to connect with to reach with the families. And again, just kind of digging into your Minnesota Student Survey to see which protective factors are most salient for each of the communities and which need to most be boosted. And like I said, it's so important that not about us without us to identify what prevention strategies should be implemented with that community and getting their voice about what they think would be beneficial. But it doesn't hurt to have some ideas in your back pocket. So that's why the strategies listed here are grayed out. So when you sit down with them, you can generate ideas together. And so the last slide, I think here, one of the last slides, at Wilder, we created a toolkit on infusing equity and cultural responsiveness into local substance use prevention efforts. While the toolkit was created for substance use prevention coalitions, I think it can work for coalitions. I mean, whether you're doing SHIP work, suicide prevention work, building ACEs and resilience, the toolkit kind of shows you how to find data and has some worksheets and tip sheets to work through. So I think it's relevant beyond just substance use prevention efforts. And just a note, two people, Nick and Jody from one of the other sessions that's happening this afternoon, we've got a case study in the toolkit from the great work they're doing at Lincoln Park in Duluth. So yeah, we can put that link in the chat. And then any questions that you might have for us? This is Jackie and I's information, and I'll quick get that toolkit.
And all the links are here on this page.
I just know that sometimes people want to take a look at stuff before the slides get posted. So here is a link to that toolkit. And the toolkit's kind of overwhelming, I've been told, but it's kind of broken down by step. So I think you can revisit it, use pieces, use worksheets, and then come back to it when you're ready for the next step. Yes. Thank you everyone for your persistence in waiting for the link and putting up with our scratchy voices and fast voices.
This is all great information. Listen to mine now. Yeah. It's contagious. So we just have like 2 minutes. Are there any questions? You want to unmute or put them in the chat and ask Jackie or Melissa yourself?
I see that Melissa's already been answering questions in the chat.
Yeah.
So.
Yeah.
Hi, this is Anne, and I was thinking of both of you when I happened to catch part of an interview Sunday morning on Face the Nation with people from the Violence Project. I don't know if you've ever worked with them. They're apparently the co-founders are at Hamlin and Metro State. But it was really interesting. It really affirmed what you were saying, because they were also studying people who almost committed a mass shooting, and they talked about how often the youth or young adults were suicidal. And when they asked what stopped them or what made a difference, it was usually that some caring person or adult had connected with them, and that stopped everything. So I just wanted to share that. I thought that was really
That's really,
along what you've been telling us.
and that ties in with Melissa's, the paper that she had linked here, where one of the, for the non-Native American, I think if I'm remembering this correctly, one of the factors that contributed to having suicidal ideation was that the student or the person had perpetrated violence, actually. So that was one of the risk factors for suicidality.
Okay, and thank you both so much. Sorry to have kind of rushed you through this with the issue with the link, but as always, I just always enjoy hearing from you, your expertise, your wisdom, everything that you do. The slides are going to be available in the post email, I understand, or the post. You'll get them. Okay.
And Jackie and I can work on kind of taking a look at ACEs by rural, urban, and then taking a look at kind of the most salient protective factors for rural versus urban. And maybe we can put together a handout that goes out with those slides to Jody's question.
Oh, that'd be great. That would be great. Okay, we're going to have to wrap up. So thank you again. The final session, please join us for that. There's a lot of information that's also going to be shared there. It's great information. Susie just put the link in the chat, or you can find it on the webpage. So thank you very much again for joining this session. And hopefully we'll see you in like 15 minutes at the closing. Thank you.
Thanks, everybody.